Indeed, it's a moment of joy in a pandemic. The 15 Chinese doctors who arrived to the country from China will not be attending to COVID-19 patients anytime soon. This is because the doctors are not licensed to practice in Nigeria. The Presidential Taskforce on the pandemic says the medical team have only come to share expertise. It says the doctors are currently being quarantined at the CCCC Construction Company's medical facility in Abuja, after which they will be tested to ascertain their status. Lara Afolayan reports.
The arrival of the Chinese medical team has raised a lot of concerns among Nigerians. And at this meeting between the Presidential Task Force and legislators, the lawmakers are also asking questions on the relevance of this mission. But the task force is quick to make it clear that the team is here for the purpose of expertise sharing alone. It also adds that the doctors are currently in isolation, pending the confirmation of their health statuses.
At the end of the 14 days, we'll run a test. If they are given a clean bill of health, then we can now begin to engage with them for them to come and finish their installations of the things they brought in the two facilities which they have provided. They didn't come on the invitation of the federal government. They came as a package of corporate social responsibility of CCECC.
The legislators want mass testing of Nigerians, whether or not they show symptoms of the disease. It as well seeks the use of a single account for all donations towards containing the pandemic.
Whatever monies have been raised by the corporate bodies, the banks, NNPC, and maybe the IOCs, should be in one single account.
The number of molecular laboratories available for testing will be 11 by weekend. This comes as laboratories in 5 northern states get an upgrade for testing purposes. Though mass testing is impossible for now, as facilities are limited, the Center for Disease Control says Nigeria is in the early stages of community transmission.
This National Assembly should develop a legislative framework to prepare Nigeria for any future pandemic.
We have been able to, in Abuja here, create capacity for at least, let us say, 1,000 within next week, 1,000 beds. We have also been sensitive to the fact that there are various layers of personalities who may be infected.
We have increased our testing capacity to about 1,500 per day. Now the challenge is no longer what the lab can do, it's the field workers in Nigeria getting the samples to the lab.
The Presidential Task Force emphasizes the country's commitment to striving for the best as it prepares for a possible worsening situation through stockpiling of medication and adequate capacity installation at its isolation centers. Lara Afolayan, TVC News.